are going to be. I'm going to begin with you, Honorable Leela, and before I hand over the stage to you, let me introduce you. Honorable Leela Sharon Aheer is a dedicated public servant, entrepreneur, and advocate for equity and innovation. First elected to Alberta's Legislative Assembly in 2015 and re-elected in 2019, she served as Minister of Culture, Multiculturalism, and Status of Women, where she advanced Clare's Law, strengthened protections against gender based violence, and proclaimed Canada's first Women's Entrepreneurship Day. Her legislative work includes the Health Professions Protecting Women and Girls Amendment Act 2022. A professional musician and a longtime community leader, she now holds senior roles in health innovation and business, contributing to the inclusive economic growth across Alberta and beyond. Thank you for joining us, Honorable Leela. The stage is yours.
Thank you so much, Hemant ji, and again to Rishikesh ji for the invitation. I feel like a bit of that I'm having some I'm with all of these doctors and rock stars that are on this panel. I feel really privileged to be here. As a former policymaker and a person who's been at that table, it's imperative to have these discussions globally to understand directionally what we need to do in the world to really understand where healthcare is going and what is going to be necessary. Our populations are living longer. We want our seniors to be able to have phenomenal lives into their aging lives. But I'm going to focus a little bit on women's healthcare today. I'm really excited because you have so many doctors on site and a gynecologist as well too. So I'm really excited to hear what he has to say a little bit later on about his work. So I just wanted to start with a number. It's not a trend. It's not a theme. It's a number. Just to give you an idea, what less than 1 cent for every dollar of private healthcare investment deployed globally between just in the recent history, so 2020 to 2025, women's health specific companies received less than 1 cent. According to all the forums, World Economic Forum, Boston Consulting Group, it's not a rounding error. And it's a decision, and it's a consequential one, that investments we're making not mistakes in investments. I love what people are investing in, but this is a really missed opportunity. And I'm not talking just about the well-being of women. That should of course be a priority, but even just from the opportunity scope that is out there. So here's what that decision has produced, just to give you some numbers and to start the discussion. Women are diagnosed later than men for 700 different diseases, or later, sorry, not different, later than men for 700 different diseases. So, and it's not just one, there are a handful, these are several hundreds, and the female body has been consistently excluded from clinical trials because of our hormones, and we're considered inconsistent. But I mean, what a great problem to solve, right? And only 5% of the trials even report data broken down by sex, is only 5%. And so that means that medicine has essentially been practicing on half of the population and using that blueprint on the other half of the population. So I've had endometriosis my entire life. So this is very personal for me, and it affects 190 million women. And women of various cultures, backgrounds, gender, color are all affected differently by that. And do you know that globally it's only received 100 million investment over 5 years? So that's 53 cents per patient, just to give you some numbers. And cervical cancer kills 500,000 women a year. And this disease is entirely preventable. And over 1 billion women are currently navigating menopause. I'm one of those. And 1.8 million annual drain on US productivity alone. I haven't even looked at the numbers in India in particular, or Canada for that matter. So when that kind of condition receives a fraction of the research funding, as compared to men's things that are like and sorry, I hope nobody's uncomfortable with this, but if you look at like erectile dysfunction, like there's a ton of energy and money put towards that, and that's elective too. This is not it's not going to save your life, but it will save your life. If we're talking about longevity, if we're talking about the well-being of people, we're talking about mental health interventions, all this is really important. And the flip side is that we're just sort of addressing 4 conditions: cardiovascular disease, osteoporosis, Alzheimer, and menopause. That represents over 100 billion market opportunity. in 2030. So you can imagine why I'm so passionate about this, because if we can get this right, we can boost the global economy at least by a trillion annually by 2040. And that's not charity. Like that's like an underallocated trade in global markets. Um, so let's talk about each of these a little bit. Cervical cancer. I'm actually I sit on an advisory board for an organization called PAP Easy. So for women who have had a pap smear done and the speculum and the idea of all of that fun stuff, we all know what that feels like. This is a beautiful device that is usable by yourself. You don't have to go into the doctor, and it actually uploads the information to the AI. And this is where the human touch and the AI really comes in, is that you can administer cervical screening through a platform, which means can you imagine how many rural health spaces we can get to, how many women we could save? Everybody in the world has a smartphone app, right? And so these are designed for women that may never walk into a clinic, not because they don't want to, but they might not have access to one. So these are advancing along FDA pathways and all of that. But if you can imagine, the speculum for a woman's pap smear was created in 1940 and hasn't fundamentally changed since then. So I think women would love an opportunity to have a different way to have this done. Vaginal microbiome. This is really overlooked in the ecosystem. When we're looking at the microorganisms, I mean, these determine infection risk, fertility outcomes, preterm birth risk, long-term gynecological health. And the Melinda Gates Foundation right now, Bill and Melinda Gates Foundation, just deployed 2.5 billion in 2025 as a core priority. So it gives you an idea about where capital is actually being deployed, but are we actually digging into that? What are the opportunities? Gut microbiome. This isn't just for women, this is men and women. That vagus nerve, this is your body's hidden command system, right? And so it attaches to problems with your heart, lungs, gut, and those signals travel upwards your vagus nerve, and that gut brain connection is just so important because it shapes mood and inflammation and cognition. So I think for longevity investors, when scientists studied the world's oldest verified living person, I believe she died, Maria, I can't remember her last name, Morera, I think it was. She died at 117 years old, and her microbiome was as diverse as somebody who is decades younger. So if you think about all of that, and if we're looking at women's longevity, spanning preventative care and precision medicine and healthy aging, is a 4.3 billion today inside a broader longevity sector, heading towards 1.8 trillion. Oh my goodness. How much longer do I have, sir? Okay, teeny tiny. Okay, I'll finish up. My goodness, 5 minutes goes by fast. Women lose 75 million years of healthy life every single year, and that is 1 week per woman per year, just to give you some numbers. And that simply disappears because of conditions that weren't properly funded and not properly studied or properly treated. So thank you so much for the opportunity. I could talk about this all day. As you can tell, I'm really excited to hear from everyone else. Thank you very, very much for the opportunity.
Thank you, Honorable Leela, for those insights once again. And with that, I call upon our next speaker, Dr. Gautam Unagar. Dr. Gautam Unagar is a pioneering laparoscopic gynecological oncosurgeon and the first of his kind in South Gujarat, with specialized fellowships in gynecological oncology from the Gujarat Cancer and Research Institute, and in minimal invasive surgery. Dr. Unagar brings deep expertise in advanced laparoscopic procedures for cancer and complex gynecological conditions. He has performed over 10,000 surgeries, positively impacting the lives of countless patients through his precision, innovation, and commitment to the care. And it's not just 10,000 patients, it's their families too. Passionate about the prevention and treatment of cancer amongst women, he continues to advocate for better awareness and early intervention. In addition to his clinical work, Dr. Nagar is an active faculty member and panelist at leading medical forums and conferences, contributing to the advancement of the field and sharing his knowledge with the broader medical community. Welcome, Dr. Nagar. Over to you.
Thank you. Thank you, Hemant, for kind words. Today is a short time and few words. on women health, a long, big topic. Globally, when we are talking about the women health, uh, definitely world is moving towards the better and better in that sense. Most of the developing country has developed good control over the infectious disease, and to some extent, developing countries also getting control over there. At that time, we are focusing on the certain non-infectious disease like diabetes, hypertension, or cancer, which is top on all this. Okay, so when we are talking about this cancer in a woman, definitely there is some embarking over the this topic regarding women cancer in women. So, and we are listed with this breast cancer, cervical cancer, endometrial cancer, ovarian cancer. Among all, why there are so many talks about the cervical cancer from entire world, from all corner of the world? That is because the most important thing from my side is it is preventable. It is 100% preventable. We have lots of things to screen it, to prevent it, for good care and cure. We could have a good prognosis and we can have a better woman life in that sense. We are talking, if we are talk about the incidence, globally it ranks about fourth rank in a woman, all cancers, and in India it is second one with the incidence of 1.3 lakhs per year out of 80,000 death of a woman because of cervical cancer in India, and globally it is about 3.5 lakh per year. So it's a huge number. Apart from this incidence and death, there is lots of morbidity, health hazards, financial issues that impact on the society in a wrong way, we can say. So let's start with some basic things. What is the cervical cancer and who get it? What is the symptoms and what is the diagnostics and the treatment modalities available at present? I think cervix, everybody is knowing, cervix is the lower part of the uterine body, that is the reproductive organ of the female. And because of the human papilloma virus infections, high risk human papilloma virus persistent infection may lead to some changes in the DNA of these cells in the cervix, and eventually it some multiplication, uncontrolled multiply is happening, and eventually turn into the tumor, and it has a very bad effect on surrounding vital organs. And early stage, there is a very few symptoms which may suspicious of malignancy, like irregular bleeding, pain, malodorous discharge. So the female usually enter into the hospitals with this complaint is less likely. Most of the time with the advanced disease, they do appear with the medical personnel. So what are the causes for this cervical cancer? The foremost important cause and counters for about 95% cases is by human papilloma virus. By these infections, not all the people who get the infections will turn into the malignancy. Most of the time, it clear by itself by the immunity of this body, but few of them will get pre-cancerous conditions and eventually cancerous. So we have a very good incubation time from infection to get the cancer. It is somewhat 5 to 25 years. So that is a pretty long time in which time we can pick up these high risk populations by means of screenings. We can ask them to get periodically pap test, that is very sensitive and specific test. In advanced form, we have a LBC, liquid based cytology with a human papilloma virus detection. By that means, we can ask this population based screening test which pinpoint these high risk groups, and we can lead them to have some medications, some follow-ups, and eventually we can separate them, either they are safe group or they are in high risk group. Apart from this screening test, we have a vaccinations, very effective vaccinations worldwide. It has proven its efficacy By that means we can keep this woman away from infections or its consequence as a malignancy. So according to me, the woman, this almost each and every woman during her sexual life, during her reproductive life is exposed to this virus, but eventually majority is out of this danger. We can have more safe group by means of vaccinations and periodically screening test. If we have a early detection and complete treatment by means of surgery, chemotherapy, radiations, targeted and immunotherapy, we could have a very good result, and in late stage we can have a good quality of life. Thank you. Thank you for.
Thank you, Dr. Unagar. That was some great insights for people to have and extends the conversation about women's health. Next, I'm going to call not doctor, but Khushboo Verma. Khushboo is a seasoned leader in digital health with over 2 decades of experience driving the development and implementation of transformative healthcare solutions. Her work spans global markets including Denmark, US, Canada, England, Finland, where she has led regulatory compliance journeys, pilots, and large scale implementations across health and welfare systems. As the founder of We Care Denmark, she brings deep hands on insight into what it takes to deliver successful digital health projects. She is passionate about helping hospitals, clinics, governments harness technology and AI to improve outcomes, always keeping patients at the center of everything she does. With a passion for customer experience, she continues to shape the future of healthcare through innovation, strategy, and impactful execution. Over to you, Kushbu.
Thank you so much. Thanks a lot, Hemant. And I hope 5 minutes are enough to speak about my topic as well. I'll keep it to that. But actually, I'm really thankful to Miss Leela and Dr. Gautam for setting up the stage. Because I started out by thinking that I will deliver a talk on digital technology, which I'm expert as, but then how to use digital in women's health is what I'm tweaking to after listening to these two wonderful talks. Uh, I must say that we started our journey with digital technologies 2 years ago, and we saw the need, the gap, that how is screening and preventive care ignored in when it comes to women's health, and that is where we got engaged in one of the biggest institutes called HTGI in Lucknow, where it's a tertiary care, and in their maternity department, which is such an important phase of women's life, within their maternity department, how can we control, how can we improve the conditions for the women that come there and increase their quality of life during the pregnancy, but also post pregnancy, after the pregnancy. So we started a pilot with them serving 2,000 women in from rural and remote areas to help them with therapy in digital, so that because everyone has a smartphone these days, it's not about the availability of or access to technology or internet. It's more about the awareness and empowerment of these people so that they can make the right choices for their health. And we onboarded these 2,000 women, pregnant women, and followed the clinical protocol that is set in PGI, translated it to digital protocol, and did all these screening. Dr. Gautam was talking about the preventive screenings, the assessments in digital manner, to see what does it, how does it affect the, how does it leads to better consequences, better results, outcomes for these patients. And we published a paper as well about that. We found significant improvement in the outcome, first of all, because these are complicated maternity cases. So in the maternal mortality and infant mortality both, but at the same time post pregnancy as well, we found significant improvement in the quality of lives of the women. So having said that, this tells me that the improvement can be done if there is will do it, the quality of life, the delay of diagnosis can be reduced if things are done in a structured way. And technology it can be a great help. And I am biased to technology because that is what I do. But technology has proven to be a great help in that journey, from taking women's health to a level where it is ignored, where it is not prioritized, where it is not prioritized for research and not even for capital, research capital actually, to a place where it becomes the norm and mainstream as in the medical care. So yes, and with the digital technology, one thing that always comes into picture is how can we avoid the fragmentation of care? And women's health, right from the outset of it, is fragmented because there is a gynecological aspect to it, which the gynecologists are aware of. There is this medical aspects or specialization aspect to it, where specialized like cardiologist or diabetologist or endocrinologist, they know it. So how do we reduce that fragmentation? And today's siloed education system in medical care, that has been a challenge as well, not only for women, that's a challenge actually for men as well. But providing again this comprehensive care, a concept where these silos can talk to each other, interact with each other, and make each other cleverer on the delivery of care. That is a key thing which I feel that will also help in general in delivery of women's health, because I've seen cases in HTPGI as well, where women are sent from one department to another because one doesn't understand the whole anatomy of it or the whole science behind it. And then they are sent from endocrinologist to gynecologist, from gynecologist to some other specialty, and then back and forth. So, avoiding having this comprehensive view and coordinated care delivery is also a thing which I feel that is very important and very important aspect in women's health. And technology can make it possible in very simple way. It's not impossible, but in physical world, it sounds a bit impossible because data sharing using paper and WhatsApp and with files and etc. That is but technology can make data available to the right people to make the right choices and the right decisions. So this was just an amalgamation of these two, that how digital technology can help in general, but how in particular we have used it in women's health. And I would really I really seek more avenues where we can transform the protocols, make it structured care and deliver care in better way, making preventive care possible as well for women and for in general everyone, but focusing on women. So that is my talk, Hemant. It was shorter maybe, but yes, if anyone has any questions or comments, I would love as well.
Definitely. Thank you, Khushbu. Thank you. While we have these 5 minute bites, it is to highlight the most important thing. In the past 5 years that I started coaching, moving from consulting to coaching, there is this exercise where we do that, where we say people that what would be the goals of your life, and they come up with so many things, and then we say that what if you had only 1 month, and then the list goes small, and then you say what if you had only 1 week and 1 day, and the list goes smaller and smaller, and what happens is that you prioritize and you prioritize and you identify the most important things on your life. So while of course the panel discussions have their value in terms of bringing diverse perspectives, when we have the expert bites where you are talking just for 5 minutes, in your head also you prioritize the most important conversation and bring it to the table, and that's what we were trying to attempt here. I think the insights shared in these 5 minutes are, yes, the tip of the iceberg, but they are to serve the purpose of triggering a lot more conversations. So thank you once again, Khushbu, for highlighting that. And next speaker I call is Ankit Srivastava.
Hi, Heyman. Thanks for your screen is frozen, so I don't know if you're trying to say something or I can go ahead. Because, all right, in the interest of time, I'll continue because I have a hard stop at 8:30 in 5 minutes from now, so I'll keep it to 5 minutes. So, first of all, thank you everyone for giving this opportunity to speak about healthcare investing. I'll share my point of view with respect to how we are going about investing in healthcare as one of the core sectors from a private equity standpoint. What we have heard is a phenomenal case, and actually it dovetails with what I'm going to share is about there is a huge demand with respect to what we have heard predominantly in the female healthcare, but in general, there is a tailwind on aging population, chronic diseases, rising healthcare demand, all that which we have heard. But we are at a real inflection point from a PE standpoint on healthcare, medtech, life sciences, and longevity. If we put all that thing together for the purpose of conversation into healthcare, is that earlier, historically, healthcare has been used as a very defensive, stable asset class to be in for it to be made investable. But given all these demands which are coming in, it has now become the most complex yet opportunity rich area for the value creation. And that is where we are looking at more as to how we can go and create the value in the process. And I believe Khushboo was talking about one department doesn't know the other department what they're doing in a particular area of ecosystem of the healthcare. And those are the things which we go actually focus towards. For us, from an invention standpoint, we look at companies or healthcare companies or companies who have reached a certain level of maturity, but they are not able to scale, which are at running at about 30 to 50% capacity of their operation. That's where we look at the operational execution or human discipline, which is required to do the execution to deliver the value and also getting the returns for the investors, what it is going after when they are investing in some of these healthcare related technologies or the companies which we are making. Uh, Public markets are increasingly, I would say, is like increasingly are short term and volatile given whatever is going on in the macro ecosystem. However, the private market offers control because it has a patient capital to go after, but only this capital can be deployed to the organizations who have a capability to execute or they are ready to let go of that operational control to the PE which is coming in to make sure that the efficiency has been maintained and commercialization can be maintained. There is a research dollar which gets into some of these early venture, early startups over there. But at the same time, investor also looks for what that returns can be in 10x and in multiples what you have already seen. We have seen powerful convergence, and what we have heard also in the conversation over here is about the AI, digital health, and other pieces which are coming in together. But what I have seen thus far is that the value can not only be created by the technology, but also as to how you go and drive the adoption of it with the laser and precision control of the discipline of execution, and also how you monetize the outcome. And some of the things I believe Khushboo picked up, Leela picked up, and also Gautam also picked up about these cases where there is an inefficiency in the system, what can be done. Just to, in the interest of time, a minute is left. Uh, the businesses which you are investing in, be it be female health or tertiary care or some oncology care, which we have talked about, I believe these businesses are not broken. What is important is that there is the commercialization and monetization in a process and a disciplined way is not being executed. And this is where our interest is. And this is where how the money can be utilized and pricing can be properly maintained while delivering the care at an affordable ecosystem. And that is the area we operate in. And this is where we bring the disciplined execution, which is rare because it's a human element. And we work with human to deliver the care what is required in the healthcare ecosystem. With that, I'll take a pause and give it back to Hemant. So thank you for the opportunity for over here, and I look forward to hearing some of the feedback and follow up after this conversation. Hemant, thank you.
Thank you, Ankit. I just discovered a bit late that while I was introducing you, or I thought I was introducing you, I was already offline, and my team was trying to signal me that Hemant, Ankit has already started because you went offline. So
That's okay. I mean, I told them like I have a hard stop at 8:30. So, but I hope I was able to. I believe I have delivered what I came to deliver. But I look forward to looking forward to connecting with this panel at a later point as well.
absolutely. Thank you very much for those insights and those triggers to the conversations. Well, this brings us to our final speaker for the Expert Bytes session. We have got Dr. Amit Saraswat. So, Dr.
Dr.
Amit
Amit,
is known as the maverick of physiotherapy, a highly accomplished physiotherapist who has redefined traditional practices through a holistic approach to body health and wellness. With a strong focus on combining manual therapy, personalized exercise, and patient education, his work emphasizes faster recovery and long term well being. Over the years, he has pioneered several groundbreaking initiatives, including Asia's first mobile physiotherapy unit in 2006, bringing advanced care directly to the patients. He's also the founder of PhysioVeda India, PhysioVeda UAE, delivering premium physiotherapy and home health care services. Known as a trusted celebrity therapist, his innovative body toning and posture correction techniques have gained worldwide recognition. Beyond clinical work, Dr. Saraswat is deeply committed to social impact through initiatives like Rehabilitators of India, empowering communities through health, strength, and independence. So, Dr. Saraswat, over to you.
hi, good evening, everyone. This is Amit Saraswat, founder, CEO of PhysioVeda. We normally work on posture. You know what is posture, actually. Posture is how you hold your body. When you sit, stand, move, and work. It silently decides how you feel, breathe, and perform your work effectively with full efficiency. If you have a poor posture, means less work, more pain, more pressure, and lower productivity. So we are right now working on a technique called PPCM, that is PhysioVeda Posture Correction Metrics. That is a structural physiotherapy framework that identifies and corrects the root cause from where the pain is coming. So I want to show you a video how we actually working. By the time video is coming in, I'll tell you how we work. In PhysioVeda, we have three kind of layers when we treat a patient. First layer who treat you. Then there is a senior therapist. If anything which a physiotherapist is not able to take care of. See the video first, then I'll tell you more about it. Hello everyone. Do you know how PhysioVeda posture correction metrics actually works? At PhysioVeda, every treatment protocol is designed, refined, and customized using this structured clinical system.
Every treatment is designed using 400 plus proven techniques and validated by national and international research journals and scientific articles, ensuring every decision is fully evidence-backed. To enhance results, we integrate advanced electrotherapy and precision-driven technology, where each modality is carefully selected and its settings optimized according to the patient's condition, diagnosis, and desired outcome, ensuring faster, deeper, and lasting recovery. Before any treatment reaches our patients, it is tested, refined, redefined, and validated on our own volunteers, ensuring every stretch and technique truly addresses the root cause. No decision is random. Every exercise, every modality, every parameter is carefully discussed, tested, and agreed upon by our team of specialists after reviewing the latest research, articles, precise assessment, and careful selection of modalities, exercises, and manual therapy techniques, guided by the latest clinical standards. We deliver a fully personalized treatment plan, tailored to each patient's condition, goals, and recovery journey.
Physioveda, everything is guided by PPCM, that is Physioveda Posture Correction Matrix. Our structured clinical system that analyze posture, identify root dysfunction, and help us build fully personalized correction protocol. Through PPCM, we ensure that every treatment is precise and evidence-based and designed for real lasting results, help you recover faster, move better, and live pain-free. So now you know how we are working. And we were talking about ladies' health, female health. We are already working on pelvic floor rehabilitation because pelvic floor is nowadays, it's a need of the hour. After pregnancy, it is more common to get pelvic floor weakness, but not only in the female, but male is also common. So we are working on it. Very soon we'll come back with the more advancement, with the more things. Thank you.
Thank you.